Discuss the Aldrich scoring system used for assessing recovery in postoperative patients. What are the key criteria evaluated, and how do they influence PACU discharge decisions? Answer: the Aldrich scoring system is a widely utilized tool for assessing a patient's readiness for discharge from the post-anesthesia care unit (POCU). The score is based on 5 key criteria: activity, ability to move all 4 extremities voluntarily; respiration, ability to breathe deeply and cough freely; circulation, blood pressure within 20% of preoperative levels; consciousness, level of consciousness ideally being awake and alert; oxygen saturation, maintaining oxygen saturation above 92%. Each criterion is scored from 0 to 2 with a maximum score of 10. A score of 9 or 10 generally indicates that the patient is stable enough to be discharged from the PACU. It is important for anesthesiologists to be aware of the Aldrich scoring system as it provides a standardized approach to evaluating postoperative recovery, thereby reducing the risk of premature discharge and associated complications. The scoring criteria ensure that patients are sufficiently recovered from anesthesia before leaving the PACU. Describe the pain management strategies applicable in the postoperative care setting, emphasizing both pharmacologic and non-pharmacologic approaches. Answer: postoperative pain management is crucial for patient recovery and can be approached through a combination of pharmacologic and non-pharmacologic strategies. Pharmacologic approaches: opioids, commonly used for moderate to severe pain, e.g. morphine, hydromorphone. They provide effective analgesia but require careful monitoring for side effects such as respiratory depression and constipation. Non-opioids, non-steroidal, anti-inflammatory drugs, NSAIDs like ibuprofen or acetaminophen can be effective for mild to moderate pain and can be used in conjunction with opioids to enhance analgesic effects. Regional techniques. Techniques such as nerve blocks or epidurals can provide targeted pain relief and may reduce the need for systemic opioids, thereby minimizing side effects. Non-pharmacologic approaches, physical therapy. Early mobilization and physical therapy can improve recovery and reduce pain perception. Cognitive behavioral therapy. Techniques such as guided imagery or relaxation techniques can help patients manage pain and anxiety. Mrs. Thompson is a 70-year-old patient who has just undergone hip replacement surgery. Upon her arrival in the PACU, her Aldrich score is 7. What steps should the anesthesia team take to monitor her recovery, and what criteria should be met before considering her discharge from the PACU? Answer: upon Mrs. Thompson's arrival in the PACU with an Aldrich score of 7, the anesthesia team should implement the following monitoring and assessment steps: continuous vital sign monitoring, regularly check blood pressure, heart rate, and oxygen saturation to ensure stability. Special attention should be given to any significant changes or deviations from her baseline. Assessment of the Aldrich criteria. The team should evaluate the remaining criteria: activity, respiration, consciousness, to determine if they can improve her score. Activity: encourage her to move her extremities as tolerated. Respiration: assess her breathing pattern and ensure that she can take deep breaths. Consciousness: monitor her level of alertness and responsiveness. Pain management assessment: inquire about her pain level and administer appropriate analgesics based on her needs. Nausea vomiting assessment: monitor for signs of postoperative nausea and vomiting, upon implementing prophylactic measures if needed. Before considering discharge, Mrs. Thompson should achieve an Aldrich score of at least 9, indicating stable vital signs, sufficient respiratory effort, consciousness, and satisfactory pain control. The anesthesia team must ensure that she can meet all discharge criteria before transferring her to a standard recovery unit. Evaluate the risk factors for postoperative nausea and vomiting (POMV) and discuss the strategies to minimize these risks. Answer: risk factors for PONV include patient factors, female gender, non-smoker status, history of motion sickness or previous PONV, and younger age. Surgical factors: type of surgery, e.g. gynecological, laparoscopic, duration of surgery, and use of volatile anesthetics. Anesthetic factors: administration of opioids and certain anesthetic agents that are more likely to cause nausea. To minimize the risk of PONV, strategies include preoperative assessment, identify at-risk patients through history and a multimodal approach to anesthesia, pharmacologic prophylaxis, utilize antiemetics such as serotonin antagonists, e.g. ondansetron, dexamethasone, and metoclopramide before surgery based on the risk profile. Intraoperative techniques: use regional anesthesia when feasible, minimize the use of volatile anesthetics, and employ opioid-sparing techniques to reduce the incidence of nausea. What are the common respiratory complications encountered in postoperative patients, and how should they be managed? Answer: common respiratory complications in postoperative patients include atelectasis. This occurs due to lung collapse, often exacerbated by shallow breathing from pain. Management includes encouraging deep breathing exercises, intensive spirometry, and early mobilization. Hypoxemia. Low oxygen levels can result from atelectasis, fluid overload, or obstructive sleep apnea. Treatment may involve supplemental oxygen, bronchodilators, or positioning the patient to optimize ventilation. Respiratory depression, often caused by opioid analgesics. Respiratory depression requires close monitoring of respiratory rate and depth. If respiratory rate drops below 8 breaths per minute, naloxone may be administered to reverse opioid effects. Pneumonia. Postoperative pneumonia can develop from aspiration or hypoventilation. Prevention strategies include head-of-bed elevation, oral hygiene, and prompt mobilization. Treatment involves antibiotics if infection is confirmed. Effective management of these complications requires ongoing assessment and proactive intervention strategies to enhance patient recovery and minimize risks. Analyze the differential diagnosis for delayed emergence in a postoperative patient. What steps should the anesthesiologist take to determine the underlying cause? Answer: delayed emergence in a postoperative patient can stem from various causes, necessitating a thorough differential diagnosis including residual anesthetic effects, insufficient recovery from general anesthesia, particularly with high-dose or prolonged anesthetic agents, hypoxia or hypercapnia, low oxygen levels or elevated carbon dioxide due to respiratory depression or airway obstruction, metabolic disturbances, electrolyte imbalances, hypoglycemia, or hypothermia can affect consciousness, neurological complications, possible stroke, seizure, or other intracranial events, psychological factors, anxiety or psychiatric disorders may also contribute. To determine the underlying cause, the anesthesiologist should conduct a thorough history and physical examination, assess patient factors, previous medical history, and medications used, monitor vital signs, evaluate oxygen saturation, blood pressure, and heart rate, perform laboratory tests, check glucose levels, electrolytes, and arterial blood gases, administer supplemental oxygen, provide immediate oxygen therapy if hypoxemia is suspected, evaluate for neurological signs, use a neurological assessment to rule out potential complications. These steps are crucial for identifying the root cause of delayed emergence and guiding appropriate interventions to ensure patient safety and recovery. In the context of postoperative care, explain the importance of patient education regarding pain management and what key points should be addressed. Answer: patient education in postoperative care is vital for effective pain management, influencing recovery outcomes and patient satisfaction. Key points to address include understanding pain control options, educate patients about the different analgesics available, including opioids and non-opioids, and how they work to alleviate pain, recognizing pain levels, encourage patients to communicate their pain levels using a standardized pain scale 0-1-0, emphasizing that adequate pain management is a collaborative process. Managing side effects. Discuss potential side effects of medications such as constipation from opioids and strategies for prevention such as stool softeners and increased fluid intake, emphasizing multimodal approaches. Explain the benefits of combining pharmacologic treatments with non-pharmacologic strategies such as physical therapy and relaxation techniques. Setting realistic expectations. Help patients understand that some discomfort is normal post-surgery and pain management may need adjustments based on their individual response. Follow-up care. Reinforce the importance of attending follow-up appointments and communicating any ongoing pain issues or concerns. Discuss the management of cardiovascular complications post-surgery, specifically focusing on arrhythmias and myocardial infarction. What guidelines should be followed? Answer: postoperative cardiovascular complications, particularly arrhythmias and myocardial infarction, may pose significant risks for patients. The management strategies include arrhythmias, identification, continuous cardiac monitoring in the PACU to detect arrhythmias early, evaluation, determine the underlying cause, e.g., electrolyte imbalances, ischemia, or drug effects through clinical assessment and laboratory tests. Treatment, depending on the type of arrhythmia, atrial fibrillation, rate control with beta blockers or calcium channel blockers in consideration of anticoagulation, ventricular tachycardia, may require antiarrhythmic medications or cardioversion if hemodynamically unstable. Myocardial infarction, risk stratification, assess patients for risk factors including age, history of cardiac disease, and type of surgery performed. Monitoring. Utilize CG and troponin levels to identify signs of myocardial ischemia or infarction. Management. Immediate treatment for suspected MI includes administering oxygen, nitroglycerin for chest pain, and antiplatelet therapy. Consult cardiology for further management and interventions. Guidelines from organizations such as the American Heart Association emphasize the importance of preoperative risk assessment, intraoperative monitoring, and early recognition and intervention for cardiovascular events. Explain the significance of postoperative complications and how they can affect patient outcomes. What strategies can be implemented to mitigate these complications? Answer. Postoperative complications can significantly affect patient outcomes, leading to increased morbidity, prolonged hospital stays, and higher healthcare costs. Key complications include infections. Surgical site infections can lead to delayed healing and further surgical interventions. Thromboembolic events, deep vein thrombus (DVT), and pulmonary embolism (P) can result in severe consequences, including mortality. Respiratory issues. Complications like pneumonia can arise due to immobility and shallow breathing post-surgery. To mitigate these complications, strategies include preoperative assessment. Identify patients at higher risk for complications and tailor the surgical plan accordingly. Antibiotic prophylaxis. Administer prophylactic antibiotics to reduce infection risk. Thromboprophylaxis. Implement mechanical and pharmacological measures, e.g., compression devices, anticoagulants to prevent DVT. Analyze the role of physical therapy in postoperative recovery. What guidelines should be followed to optimize patient outcomes? Answer. Physical therapy plays a crucial role in postoperative recovery, facilitating the restoration of function, mobility, and overall well-being. Its benefits include prevention of complications. Early mobilization helps prevent complications such as atelectasis, DVT, and muscle atrophy. Pain management. Therapeutic exercises can reduce pain and improve overall comfort. Guidelines for optimizing patient outcomes. Early mobilization. Initiate mobility as soon as it is safe, often within hours post-surgery, to enhance circulation and prevent complications. Individualized exercise programs. Develop personalized therapy plans based on the patient's surgical procedure, comorbidities, and recovery goals. Patient education. Teach patients the importance of adhering to therapy and recognizing signs of potential complications. Multidisciplinary approach. Collaborate with surgeons, anesthesiologists, and nursing staff to ensure coordinated care and optimize rehabilitation efforts. What are the key differences between randomized controlled trial (RETS) cohort studies and case control studies in clinical research? Discuss the strengths and weaknesses of each study design in the context of evidence-based practice. Answer. Randomized controlled trials (RETS). Definition. Participants are randomly assigned to either the intervention or control group, minimizing bias. Strengths. Provides the highest level of evidence due to randomization, reducing confounding variables. Allows for the direct comparison of outcomes between groups. Weaknesses. Can be expensive and time-consuming. Ethical concerns may arise when withholding treatment from the control group. Cohort studies. Definition. Follows a group cohort over time to see how exposure to a risk factor affects outcomes. Strengths. Useful for studying the natural history of a disease and for rare exposures. Allows for the calculation of incidence rates. Weaknesses. Prone to selection bias and confounding variables. Not suitable for rare outcomes. Case control studies. Definition. Compares patients with a specific outcome cases to those without controls, looking backward to identify exposure. Strengths. Efficient for studying rare diseases and can evaluate multiple exposures for a single outcome. Weaknesses. Subject to recall bias and does not establish causation. The temporal relationship between exposure and outcome is often unclear. In practice, anesthesiologists should critically appraise the methodology of these studies to determine the applicability of findings to clinical practice. How should an anesthesiologist critically appraise a research article to assess its validity and applicability? Outline the steps involved in this process. Answer. Assess the study design. Determine if the design, RET cohort, case control is appropriate for the research question. Evaluate randomization and blinding. Ensure proper randomization to minimize selection bias and blinding to reduce performance bias. Review inclusion and exclusion criteria. Analyze if the criteria are appropriate and if the study population reflects the target population. Analyze outcomes. Look at primary and secondary outcomes and how they were measured. Consider whether the outcomes are clinically relevant. Consider statistical analysis. Examine if the statistical methods are appropriate, including sample size calculations and significance testing. Check for confounding factors. Identify potential confounders and whether the study controlled for them. Read the conclusion. Ensure the conclusions are supported by the data presented, avoiding overgeneralization. Following these steps ensures a comprehensive understanding of the research findings and their implications in anesthesiology practice. Mr. Smith is an anesthesiologist who is reviewing a recent study on postoperative analgesia protocols. He notices that the findings recommend a multimodal approach involving both opioids and non-opioid analgesics. What should Mr. Smith consider when implementing these evidence-based guidelines in his practice? Answer: Mr. Smith should consider the following factors. Patient population. Evaluate if the study population aligns with his patient's demographics, age, comorbidities to ensure relevance. Clinical context. Assess the context in which the study was conducted. Variations in practice settings, hospital versus outpatient, can impact the applicability of findings. Available resources. Determine if the necessary medications and monitoring equipment are available in his practice setting. Risks versus benefits. Analyze the potential benefits of the multimodal approach, reduced opioid use, better pain control, against risks, side effects, complications, collaboration with team. Discuss with the surgical and nursing teams to ensure everyone is aware of the protocol and agrees on the approach for continuity of care. Monitoring and follow-up. Establish a plan for monitoring patients postoperatively to assess the efficacy of the new protocol and make adjustments as necessary. Implementing evidence-based guidelines requires careful consideration of clinical judgment, patient safety, and teamwork. Discuss the importance of effective communication skills in anesthesiology. How can an anesthesiologist manage conflicts during preoperative consultations with patients? Answer: effective communication in anesthesiology is crucial for several reasons. Building trust. Clear communication fosters a trusting relationship between the anesthesiologist and the patient, leading to improved patient satisfaction and compliance. Informed consent. Anesthesiologists must ensure patients understand the risks, benefits, and alternatives to anesthesia, which is essential for informed consent. Preoperative anxiety. Addressing patients' concerns and providing reassurance can alleviate anxiety, leading to better outcomes. Managing conflicts. Active listening. Demonstrate empathy by actively listening to the patient's concerns without interrupting. Clarifying misunderstandings. Summarize the patient's concerns to confirm understanding and clarify any misconceptions. Providing evidence. Use evidence-based data to explain recommendations, helping patients understand the rationale behind decisions. Collaborative problem solving. Involve the patient in decision-making to empower them and create a sense of control. What are the key components of a lifelong learning strategy for an anesthesiologist, and how can engagement in professional organizations enhance this process? Answer: key components of a lifelong learning strategy include ongoing education, regular participation in continuing medical education (CME) activities, including workshops, seminars, and online courses to stay current with advancements in anesthesia. Self-assessment, engaging in self-assessment practices such as reflective learning to identify knowledge gaps and areas for improvement. Peer learning, collaborating with colleagues to share experiences and knowledge. Fostering a culture of learning. Research participation, involvement in clinical research projects to contribute to the field and enhance practical knowledge. Engagement in professional organizations. Networking provides opportunities to connect with peers, mentors, and experts in anesthesiology. Access to resources. Offers access to journals, guidelines, and resources that can facilitate ongoing education. Conferences and workshops. Opportunities to participate in conferences to learn about the latest developments and innovations in anesthesiology. Advocacy and leadership. Being part of professional organizations allows anesthesiologists to advocate for their profession and take on leadership roles, which further enhances their professional development. By committing to these components, anesthesiologists can ensure they remain competent and knowledgeable throughout their careers. How can anesthesiologists integrate findings from clinical research into their daily practice while ensuring patient safety and quality of care? Answer: anesthesiologists can integrate research findings through the following steps. Critical appraisal. Systematically evaluate the validity and relevance of research findings to clinical practice. This includes assessing study design, population, and outcomes. Guideline development. Utilize findings to inform the development of practice guidelines, ensuring that they are evidence-based and tailored to the patient population. Patient-centered approach. Consider individual patient factors, comorbidities, preferences when applying research findings, ensuring that care is tailored to each patient's unique needs. Monitoring and feedback. Implement systems to monitor outcomes and gather feedback on new practices to ensure they lead to improvements in patient safety and care quality. Education and training. Provide education and training to staff about new practices and protocols, fostering a culture of safety and quality. By applying these strategies, anesthesiologists can effectively translate research into practice while prioritizing patient safety. Explain how the choice of study design, RET, cohort, or case control impacts the interpretation of clinical outcomes in anesthesia research. Provide examples of when each design would be most appropriate. Answer: the choice of study design greatly influences the interpretation of clinical outcomes. Randomized controlled trials, RETS, appropriate when assessing the efficacy of a new anesthesia technique or drug where causation needs to be established. Interpretation impact. High internal validity due to randomization minimizes bias, allowing for clear conclusions about causality. Cohort studies, appropriate when investigating long-term outcomes of different anesthesia techniques in specific populations, e.g., elderly patients undergoing surgery. Interpretation impact. While they provide valuable longitudinal data, they are susceptible to confounding factors, which can complicate causation interpretation. Case control studies, appropriate when exploring rare adverse events, e.g., postoperative complications, to identify potential risk factors. Interpretation impact. Provides insights into associations but cannot confirm causation due to retrospective design and potential recall bias. What role do quality measures and clinical pathways play in enhancing patient outcomes in anesthesia? Discuss specific examples of measures that can be implemented. Answer: quality measures and clinical pathways are essential for standardizing care, establishing clear guidelines for anesthetic management to ensure consistency across providers, reducing variability in care, improving outcomes, utilizing data-driven measures to monitor and evaluate patient outcomes leading to continuous quality improvement, enhancing communication, facilitating communication among the surgical team, which is vital for patient safety and coordination of care. Examples of quality measures: postoperative pain management, monitoring patient-reported pain scores to assess the effectiveness of analgesic protocols, anesthesia complication rates, tracking the incidence of complications, e.g., awareness during anesthesia to identify areas for improvement, patient satisfaction surveys, evaluating patient feedback on their perioperative experience to enhance service delivery. Why is interdisciplinary collaboration critical in the perioperative setting, and how can anesthesiologists foster effective teamwork? Provide examples of strategies that can enhance collaboration. Answer: interdisciplinary collaboration is crucial because patient safety enhances communication among the surgical team, reducing the likelihood of errors and improving patient safety. Comprehensive care facilitates a holistic approach to patient management, considering all aspects of patient care: medical history, allergies, preferences, efficiency. Streamlines workflow, minimizing delays in the surgical process and improving resource utilization. Strategies to foster collaboration: regular team meetings, schedule preoperative briefings to discuss cases, roles, and responsibilities, ensuring everyone is on the same page. Shared electronic health records, AIR. Utilize EHRS to ensure all team members have access to up-to-date patient information, enhancing decision-making. Interprofessional training. Participate in joint training sessions with surgical teams to build rapport and improve communication skills. What communication techniques can anesthesiologists use to improve the preoperative consultation process, particularly when addressing patients' fears and concerns about anesthesia? Answer: anesthesiologists can utilize several techniques to improve communication. Empathetic listening, demonstrating empathy by actively listening to patients' concerns and acknowledging their feelings, can build rapport and trust. Clear and simple language, avoiding medical jargon and using layman's terms to explain procedures and risks ensures patients understand the information provided. Providing information. Use visual aids or brochures to explain anesthesia procedures, risks, and benefits, making the information more accessible. Encouraging questions. Create an open environment where patients feel comfortable asking questions, which can help alleviate anxiety. Follow up. Offer to answer any further questions post-consultation, reinforcing the support available to them. These communication techniques enhance the preoperative experience and empower patients, leading to greater satisfaction and improved outcomes. What are the key components of an anesthesia machine, and how do they function together to ensure safe delivery of anesthetic agents? Answer: an anesthesia machine comprises several key components, including gas delivery system. This system provides oxygen and other gases, e.g., nitrous oxide. It includes pressure regulators, flow meters, and a common gas outlet. Vaporizer. The vaporizer converts liquid anesthetic agents into vapor form. It must be calibrated correctly to deliver the appropriate concentration of anesthetic. Each vaporizer is specific to a certain agent, and the temperature and flow rate affect its performance. Breathing system. This includes the circuit through which gases flow to and from the patient. The system can be either a closed or semi-closed circuit, and components include the ventilatory equipment, e.g. bag valves, ventilator. This is used to deliver positive pressure ventilation to the patient. Modern ventilators have various modes to assist or control the patient's breathing. Monitors. Vital signs and patient status are continuously monitored, including end-tidal pulse oximetry and ECG scavenging system. This system removes excess anesthetic gases from the operating room to minimize exposure for staff. Discuss the importance of routine checks and maintenance of anesthesia machines and the potential risks of neglecting these protocols. Answer: routine checks and maintenance of anesthesia machines are vital for patient safety. These protocols typically include pre-anesthetic checks. Daily checks include verifying the functionality of the gas delivery system, ensuring the presence of adequate oxygen and nitrous oxide, and checking vaporizer calibration. Leak testing ensures that the gas delivery system is free from leaks, which can lead to inadequate anesthesia or increased exposure to anesthetic gases. Monitoring device functionality. All monitoring devices should be tested for accuracy before use, as faulty readings can lead to mismanagement of anesthesia. Emergency protocols. Regular training in emergency protocols, e.g. oxygen supply failure, ensures staff can react promptly. Neglecting these protocols can result in severe consequences, including anesthetic awareness. Inadequate delivery of anesthetic agents can lead to the patient being conscious during surgery. Hypoxia. A malfunctioning gas delivery system can cause inadequate oxygenation, leading to hypoxia and potential brain damage. Equipment failure. Lack of maintenance can lead to equipment failures during critical moments, jeopardizing patient safety. Regular adherence to maintenance guidelines, as outlined by the American Society of Anesthesiologists (ASAP), is essential to mitigate these risks. In the context of monitoring technologies, how would you approach troubleshooting a case where the pulse oximeter displays an inaccurate reading? What steps should be taken? Answer: when troubleshooting an inaccurate pulse oximeter reading, the following steps should be undertaken. Verify sensor placement. Ensure the sensor is placed correctly on an appropriate site, e.g. finger, earlobe. Poor placement can lead to inaccurate readings. Check for motion artifacts. Movement by the patient can cause false readings. If the patient is moving, try to stabilize the hand or use a site less affected by movement. Assess circulation. Ensure good peripheral perfusion. Cold extremities, hypotension, or peripheral vascular disease can result in poor sensor function. Warm the extremities if necessary. Inspect the sensor. Check for any dirt, blood, or debris on the sensor that might impede function. Clean or replace the sensor if needed. Calibrate the device. Some monitors require periodic calibration. Refer to the manufacturer's guidelines for calibration procedures. Evaluate for interference. Certain factors such as nail polish, artificial nails, or excessive ambient light can interfere with readings. Remove or adjust these factors as necessary. Consider alternative monitoring. If the issue persists and the reading remains unreliable, utilize other monitoring methods, such as arterial blood gas analysis, to obtain accurate oxygen saturation levels. Mr. Anderson is an anesthesia provider who encounters a situation where the vaporizer is not delivering the expected concentration of sevoflurane during a procedure. What steps should Mr. Anderson take to address this situation? Answer: Mr. Anderson should take the following steps to address the issue with the vaporizer. Confirm the setting. Ensure the vaporizer is correctly set to the desired concentration. Check the dial and ensure it is not inadvertently set too low. Check for leaks. Inspect the vaporizer for any leaks. A leak in the system can cause dilution of the anesthetic gas. Perform a leak test if necessary. Verify gas supply. Ensure that the oxygen and nitrous oxide supplies are adequate. Low gas supply can affect vaporization and delivery. Inspect the vaporizer. Check the vaporizer's calibration and functionality. If the vaporizer is malfunctioning, it may require a calibration or replacement. Switch to a backup vaporizer. If the issue persists and cannot be resolved quickly, Mr. Anderson should switch to a different vaporizer to ensure continuous delivery of the anesthetic agent. Communicate with the surgical team. Inform the surgical team of the situation and any potential implications for the patient. This transparency is vital for safety and decision-making. Document the incident. Document the incident thoroughly in the patient's medical record, noting the actions taken and any changes in the patient's condition. What are the safety standards established for anesthesia machines, and how do they contribute to patient safety? Answer: safety standards for anesthesia machines are primarily established by organizations like the American Society of Anesthesiologists (ASAT) and the Food and Drug Administration (FDA). Key standards include electrical safety. Machines must comply with electrical standards to prevent shock hazards. This includes proper grounding and protection against short circuits. Gas flow and delivery standards. Anesthesia machines must be designed to ensure accurate gas flow and prevent hypoxic mixtures. This includes built-in safety features to avoid incorrect gas delivery. Vaporizer safety. Vaporizers must have safety mechanisms such as keyed fillers to prevent the filling of the wrong agent, thus reducing the risk of administering the incorrect anesthetic. Alarm systems. Machines should be equipped with audible and visual alarms to alert providers to critical issues such as low gas supply, circuit leaks, or malfunctioning monitors. Regular maintenance protocols. Compliance with routine maintenance protocols is essential. Machines must be inspected and serviced regularly following manufacturer guidelines. Training and certification. Anesthesia providers must receive proper training on equipment usage and safety protocols. Certification programs ensure that providers are knowledgeable about machine operations and safety measures. Explain the role and significance of monitoring technologies in anesthesia practice, focusing on at least 3 different types of monitors used. Answer: monitoring technologies play a crucial role in anesthesia practice by providing real-time data on patient physiology and ensuring safe anesthetic administration. Key types of monitors include pulse oximeter. This non-invasive device measures arterial oxygen saturation (SPO). It works by passing light through a vascular bed and detecting changes in light absorption between oxygenated and deoxygenated blood. Continuous monitoring allows for immediate detection of hypoxemia, prompting timely interventions. Capnometer. This device measures end-tidal carbon dioxide echo levels, providing insights into the patient's ventilation status. Echo readings help assess the adequacy of ventilation and can indicate respiratory depression or hyperventilation. Analyzing capnogram waveforms further aids in identifying conditions like bronchospasm or equipment malfunction. CG monitor. Continuous electrocardiographic monitoring is vital for detecting arrhythmias and assessing cardiac function. By providing real-time data on heart rate and rhythm, CG monitors enable the anesthetist to manage potential cardiac complications effectively. The ASA guidelines recommend continuous CG monitoring for all patients undergoing anesthesia. Describe the different types of delivery systems for anesthetic agents, including the advantages and disadvantages of each system. Answer: delivery systems for anesthetic agents can be categorized into several types. Vaporizer systems. Advantages: precise control of anesthetic concentrations, easy adjustment during procedures, and the ability to use various volatile agents. Disadvantages: potential for malfunction and the need for regular calibration and maintenance. If not correctly filled or adjusted, it may deliver inadequate or excessive doses. Intravenous Roman delivery systems. Advantages: rapid onset of action and titratable dosing. IV agents can be administered continuously or intermittently, allowing for flexible anesthetic management. Disadvantages: requires venous access, which can be challenging in certain patients. There is also a risk of complications such as thrombosis or infection at the injection site. Inhalational delivery systems. Advantages: provides rapid control over anesthetic depth and is effective for maintaining anesthesia during procedures. Disadvantages: may lead to variable anesthetic concentrations due to changes in lung volume or patient ventilation. Inhalational agents can also cause respiratory irritation and airway complications. Regional anesthesia delivery systems. Advantages: offers targeted anesthesia with reduced systemic effects and can provide post-operative pain relief. Disadvantages: techniques require advanced skills and there are risks of complications such as nerve injury or hematoma formation. Understanding the strengths and weaknesses of these delivery systems allows anesthesia providers to select the most appropriate method based on patient needs and the specifics of the surgical procedure. What troubleshooting steps should an anesthesia provider take if the patient exhibits signs of hypoventilation during surgery? Answer: if a patient exhibits signs of hypoventilation during surgery, the anesthesia provider should follow these troubleshooting steps. Assess the patient's airway. Ensure that the airway is patterned. Check for any obstruction caused by the tongue, secretions, or equipment malfunction. Adjust ventilator settings. If the patient is on mechanical ventilation, assess and adjust the tidal volume and respiratory rate settings. Ensure that the mode of ventilation is appropriate for the patient's needs. Increase oxygen delivery. Increase the oxygen concentration being delivered to the patient. This may involve adjusting the settings on the anesthesia machine. Evaluate neuromuscular blockade. If neuromuscular blockers were administered, evaluate their effect. Consider reversing the blockade if the patient is too deeply paralyzed. Monitor end tidal co. Check the capnography reading to confirm hypoventilation. An increase in echo can indicate inadequate ventilation. This information is critical for making informed decisions regarding interventions. Assess patient positioning. Ensure the patient is in an optimal position for ventilation. Malpositioning can impede lung expansion and ventilation. Prepare for emergency interventions. If the situation does not improve, be prepared to perform manual ventilation using a bank mask ventilation technique or, if necessary, secure the airway via intubation. Document findings and interventions. Ensure that all findings, adjustments made, and the patient's response are documented in the medical record for future reference. These steps are crucial for effectively managing hypoventilation and ensuring patient safety during anesthesia. Analyze the implications of anesthetic agent selection on patient outcomes during surgery, particularly focusing on the pharmacokinetics and pharmacodynamics of different agents. Answer: the selection of anesthetic agents significantly impacts patient outcomes influenced by their pharmacokinetics, absorption, distribution, metabolism, and excretion, and pharmacodynamics effects on the body. Consider the following: volatile agents, e.g., isoflurane, sevoflurane. Pharmacokinetics. These agents are inhaled and absorbed through the alveoli into the bloodstream, where they exert effects on the central nervous system. Pharmacodynamics. They provide rapid onset and offset of action, facilitating quick adjustments during surgery. However, they can cause cardiovascular depression and respiratory irritation, influencing patient recovery and stability during surgery. Intravenous agents, e.g., propofol, thiopental. Pharmacokinetics. IV agents have a rapid onset of action due to direct delivery into the bloodstream. They are distributed quickly to highly perfused organs. Pharmacodynamics. These agents provide rapid induction of anesthesia and can facilitate faster recovery. However, they can cause hypotension and respiratory depression, necessitating careful monitoring. Opioids, e.g., fentanyl, sufentanil. Pharmacokinetics. Opioids are absorbed systemically and can have a prolonged effect due to redistribution and metabolism in the liver. Pharmacodynamics. While effective for pain management, they can lead to respiratory depression and delayed recovery, particularly in older adults or those with pre-existing respiratory issues. The choice of anesthetic agents must consider the patient's medical history, the surgical procedure, and the potential side effects to optimize outcomes and minimize complications. Discuss the regulatory guidelines surrounding anesthesia equipment and technology, focusing on the role of the FDA and the implications for clinical practice. Answer: the Food and Drug Administration (FDA) plays a crucial role in regulating anesthesia equipment and technology to ensure safety and efficacy. Key regulatory guidelines include pre-market approval. Anesthesia devices must undergo rigorous testing and obtain FDA approval before they can be marketed. This includes assessing safety, effectiveness, and compliance with applicable standards. Classifications of devices. Anesthesia machines and accessories are classified into different categories, Class II or OMN3, based on their risk level. Class II devices, such as monitors and vaporizers, require pre-market notifications 510K to demonstrate equivalence to existing products. Quality system regulations care. Manufacturers of anesthesia devices must adhere to QSR, which outlines the requirements for design controls, production processes, and post-market surveillance to ensure device safety and performance. Reporting adverse events. Healthcare providers must report adverse events or device failures to the FDA, enabling monitoring of device performance and ensuring timely interventions when issues arise. Reprocessing guidelines. The FDA provides guidelines for the reprocessing of reusable anesthesia equipment, ensuring that such equipment is cleaned, disinfected, and sterilized to prevent cross-contamination and infection. Clinical practice implications. Anesthesia providers must stay informed about FDA guidelines and device recalls, ensuring the use of approved and safe equipment in clinical practice. Continuous education regarding emerging technologies and compliance with regulations is vital for maintaining high standards of patient care. Adhering to these regulatory guidelines promotes patient safety and enhances the overall quality of anesthesia care.